Hello to everyone. My name is Clara. I am an epidemiologist working at the Barcelona Institute for Global Health, and I am also a predoctoral student there. I am in my last and the fifth year of my PhD, which is about maternal health in Sub-Saharan Africa. And yeah, I am really a passionate epidemiologist, and I love the work I do. So I knew the Global Health Next Generation Network through one of my best friends and my colleagues in IS Global, Elena Marvan, who is the chair of the organization. And she really introduced me to this world. And I participated a couple of years ago in one of the conferences organized by the network in Barcelona. And I follow more or less the different activities the network performs through the social networks. So, as I said, I am an epidemiologist. I am really focused on different steps of the design and performance of epidemiological studies, mainly observational studies, from the study design, the design of the tools, also the fieldwork, and then I also perform data analysis, and I write papers and these things. And all this process is part of my PhD. So I am also a predoctoral fellow. And I also, on the other hand, contribute and participate into a couple of clinical trials as project manager and assistant. But this is a bit of a different kind of work. So it's not really epidemiology, it's more clinical research. At university, I studied biomedical sciences here in Catalonia at Autonomous University of Barcelona. It is really a bachelor, quite how to say it, it's more based on basic science, not really applied science or epidemiology. That is what I do now. So after that, I was a bit lost. I didn't know exactly where to go because I didn't like a lot basic science. So I tried to look for options. I spent a year studying and reading and learning English and these things. And at the end, I found global health. So it was a matter of luck, I think. I found the Masters of Global Health and Clinical Research with the International Health Track of University of Barcelona. And I decided to perform this last master, the clinical research one, because it gave me the opportunity to perform a PhD after that. And that's why I did. I took this master in Barcelona together with IS Global, so apart from the University of Barcelona. And then I started working there as an intern and then as a predoctoral fellow. I have a scholarship to perform my PhD, and in fact, this is the one and the only one that I had to submit. So what I did to obtain it, or what was my secret, I think that I was really passionate in that moment. I really wanted. So I wrote a project that was credible, was honest, and that I wanted to obtain. So I think that if you are true with yourself and you do what you really want, and you are not there because you think you need to be there, it's more like you feel it, I think this is the way to go and to write a really good proposal. But I have to say that I don't have a lot of experience writing proposals, but this one worked well for me and I obtained it. My studies for sure helped me to achieve my objectives in a different ways. The studies I took at university gave me more the skills to work in different environments, to be able to look for information, to relate with other people, to work in a team. Then my master's studies gave me some theoretical background, opened my mind. So basically they showed me which is the potential of the field in the one I work. So this is what they show me, I think. Not really the things that I do on a daily basis. These are things that you learn when you work. But in general, I learn different skills that I'm now applying to my job and to my career. So I am really interested in many things outside the work. So personally, because I like to, when I finish my job hours, so I normally stop and try to do different things, because I think that it's also something healthy for our minds. And I like, for example, pottery, which can sound a bit strange, but yeah, I like to perform creative activities with my hands, because this is something really different from what I do normally during my working hours. But then when it comes to work, I am in general interested in the tools I use, the methods. More than research fields, I work on maternal health, but I would say that if I had to change and work in another thing, I would maybe study more statistics, for example, or I would focus on data analysis or on study design. So more on a methodological part of the work than on other global health issues, but always under this umbrella of global health. Global health, I think that is a field of knowledge, not only research, but also policy, cooperation, training. Okay, is a very broad field that includes different aspects of health that affects people across borders. Now I think that COVID is a good example of what is global health, because it's affecting populations worldwide. But in general, this is the idea I have of global health without a pandemic in between, but of aspects of health that cross borders in general. Good aspects such as interventions that can be applied in different parts of the world and that they can work better or not in one country or another, but also diseases that can spread. This is the idea, I think. Yeah, that's why I like it, because it's very, very broad and you can do many things under this umbrella, and all of them are very interesting. I am focused mainly on observational research, and I think that in general it's not seen as as a component of global health research that gives a lot to the society or to the global health field, because with a clinical trial the impact is quite clear. You can know, for example, if a drug works or not. But with observational research, this impact is a bit more fluid. But for me, it is key in the global health field, because first, before designing an intervention or designing a clinical trial or trying to look for a solution for a problem, you have to define this problem, describe this problem. And that's what I like to do. And that's what my work is based on describing and evaluating what is the current situation of malaria in pregnancy, for example, which is one of my areas of interest. And then after that, we can advocate for different policies, new interventions, etc. But I think that I work on the first step, and that's something that I really like. So I would say that it's important to try different things. Sometimes you are lost. I was at some point. It's important to try to learn. It's important especially to learn skills, to know exactly what you are good at or what you like to do, and then apply it to a field that it's really crossing borders and helping people from all over the world. So in the end, the important thing is what you want to do. So try to look for your passion, and you will be for sure motivated to continue working. And that's all. In the end, if you try and you fail, you can jump to another issue and change a bit the scope of your work. And global health give you this opportunity always, because it's a very broad field. So you can always change a little bit what you are doing, and you will be still working on global health. So I would say jump to the pool and try it. It's difficult because I've been in many places these last years, mainly in Africa where I work, but maybe I would say I would like to travel to Asia, because it's the only continent I've never visited. But I'm not sure exactly of which specific country, because there are many, all of them very interesting, and it would be the first time for me there. So I think that I have to start exploring Asia.